If you're living with diabetes and struggling with painful leg cramps at night, constant fatigue, high blood pressure, or blood sugar that refuses to come down no matter how carefully you eat, listen closely. Many doctors now check one specific mineral first when patients report these symptoms. The surprising reality? Up to 60 to 80% of people with type 2 diabetes are deficient in key minerals because of medications, like metformin, increased urinary loss from high glucose, poor absorption, and modern diets lacking mineral-rich foods. This hidden deficiency creates a vicious cycle that worsens insulin resistance, raises blood sugar, triggers muscle cramps, and pushes a 1C higher. So, here's the big question. Could correcting the best mineral for diabetics be the simple, natural fix that finally helps stop cramps, lower blood sugar, and improve your energy and A1C? In today's video, we're counting down the top 4 best minerals for diabetics, backed by strong research and recommended by doctors. Stay with me until the end, because the number 1 might surprise you. Let's dive in. Number 1. Magnesium, glycinate or citrate form. Magnesium is one of the most essential and most commonly deficient minerals for diabetics that lowers blood sugar and stops cramps, required by over 300 enzymes involved in glucose metabolism, insulin signaling, muscle relaxation, nerve function, energy production, ATP, and blood pressure regulation. Yet more than 60% of people with type 2 diabetes are deficient due to metformin reducing intestinal absorption by up to 30%, high blood sugar increasing urinary excretion, and typical diets low in magnesium-rich foods like leafy greens, nuts, and seeds. Painful nighttime leg cramps, chronic fatigue that sleep doesn't fix, muscle twitching, irregular heartbeat, high blood pressure, anxiety, restless legs, and stubborn insulin resistance are classic signs of low magnesium that make blood sugar harder to control and A1C higher over time. Magnesium supplementation helps powerfully across these symptoms. Large meta-analyses of randomized controlled trials show 300 to 400 milligrams daily can lower fasting blood glucose by 10 to 20 milligrams per deciliter, reduce HbA1c by 0.5 to 1.0 percentage points over 3 to 6 months, dramatically decrease muscle cramps and spasms, often within 1 to 4 weeks, significantly improve insulin sensitivity, relax blood vessels for better circulation and lower blood pressure, reduce inflammation markers like CRP, support heart rhythm stability, alleviate restless leg syndrome, and improve sleep quality, all critical for long-term diabetes management. Take 300 to 400 milligrams of magnesium glycinate or citrate daily in divided doses with meals. These forms are highly bioavailable and gentle on the stomach, unlike oxide or sulfate. Food sources include spinach, almonds, avocado, pumpkin seeds, and dark chocolate, in moderation. Side effects like loose stools are rare with chelated forms. Start with 200 milligrams and increase gradually if needed. Number 2. Potassium. Potassium is a crucial electrolyte mineral for diabetics that lowers blood sugar and stops cramps, essential for proper muscle contraction and relaxation, nerve signaling, fluid balance, counteracting sodium to regulate blood pressure, and supporting insulin secretion from the pancreas. Levels frequently drop in diabetes due to diuretic medications, insulin therapy, high glucose pulling potassium out through increased urination, and diets low in potassium-rich foods. Severe leg cramps, especially at night, muscle weakness, extreme fatigue, irregular heartbeat or palpitations, constipation, high blood pressure, and even worsened insulin resistance are common symptoms of low potassium that make blood sugar control more difficult and increase heart risks. Potassium helps restore balance effectively. Clinical studies and observational data show higher potassium intake or careful supplementation can lower fasting blood glucose, reduce HbA1c modestly over time, significantly decrease systolic blood pressure by 5 to 10 millimeters of mercury on average, prevent cramps and muscle spasms, improve insulin secretion, support kidney function, and protect heart rhythm, especially important since diabetes doubles cardiovascular risk. Aim for 3,500 to 4,700 milligrams daily, primarily from food. Avocados, spinach, salmon, sweet potatoes, tomatoes, bananas in strict moderation, or low-dose supplements, 99 milligram tablets, only if doctor approved and kidney function is normal. Side effects are rare with food sources. Hyperkalemia risk is low unless kidney function is impaired. Number 3. Zinc. Zinc is an important trace mineral for diabetics that lowers blood sugar and stops related cramps, essential for insulin synthesis, storage, and release in the pancreas, proper immune function, wound healing, taste and smell sensation, and powerful antioxidant defense. Diabetics often lose excessive zinc through urine and have 20 to 30% lower levels than non-diabetics due to high blood sugar and poor absorption. Poor immunity, slow healing wounds, loss of taste or appetite, hair loss, frequent infections, muscle cramps, and worsening insulin dysfunction are hallmark signs of zinc deficiency that elevate blood sugar and A1C. Zinc supplementation helps comprehensively. Randomized controlled trials and meta-analyses show 15 to 30 milligrams daily can improve insulin sensitivity, lower fasting blood glucose and HbA1c by 0.5 to 1.0 percentage points over months, reduce inflammation and oxidative stress, support better immune response against infections, decrease neuropathy symptoms, and aid overall metabolic health. Take 15 to 30 milligrams zinc picolinate or gluconate daily with food to avoid nausea. Food sources include oysters, beef, pumpkin seeds, and chickpeas. Side effects like nausea or copper imbalance are rare at moderate doses. Balance with copper if long-term. Number 4. Chromium picolinate. Chromium picolinate is a highly effective trace mineral for diabetics that lowers blood sugar and helps stop related cramps, playing a direct role in forming glucose tolerance factor that helps insulin bind to cell receptors and transport glucose efficiently. Many diabetics are deficient due to poor dietary intake and increased urinary loss from high blood sugar and certain medications. Intense carbohydrate cravings, fatigue, muscle weakness, weight gain around the belly, and unstable blood sugar despite efforts are classic signs of low chromium that keep A1C elevated. Chromium picolinate helps break this cycle powerfully. Extensive meta-analyses of randomized controlled trials show 200 to 1,000 micrograms daily can lower fasting blood glucose by 10 to 20 milligrams per deciliter, reduce HbA1c by 0.4 to 0.8 percentage points over 3 months, significantly decrease carbohydrate cravings, improve energy and muscle function, enhance overall glycemic control, and support healthy cholesterol and modest weight management. Take 200 to 400 micrograms chromium picolinate daily with meals for best absorption. Side effects are extremely rare at recommended doses, and it's inexpensive and safe long-term. Managing diabetes isn't just about carbs and meds, it's about replenishing the best minerals for diabetics that stop cramps, lower blood sugar, and improve A1C naturally. Magnesium, potassium, zinc, and especially chromium picolinate offer powerful, doctor-recommended support for fewer cramps, stable glucose, and reduced inflammation. If this video helped you discover the #1 best mineral for diabetics to stop cramps and lower blood sugar, give it a like to help others. Subscribe for more practical, evidence-based tips, and drop a comment. Which of these minerals are you checking or adding first? Your experience could encourage someone else on their journey. Stay strong and take control.